We have resident physicians. These are residents who have graduated from medical school. They've gone through their 4 years of training, and everyone who chooses a specialty to go into, and in our situation it's family medicine, they are required to do several years of postgraduate training, and for us it's a 3-year program. They are physicians, they're doctors in training, and they need to be supervised in what they do. Medical management, procedures, etc., ambulatory and in the hospital. We currently have also a continuity clinic, which is part of the requirement, that they have a panel of patients of their own. And so we have patients who come in, establish care with the residents, and call them their doctor, and we'll take care of them, all their needs, just as I would take care of them, or Dr. Deekens would take care of them, and with supervision. We will sometimes come into the room to be with them during their interview, physical examination. We will meet all the new patients, and we will always be present for procedures during the critical portions of those procedures, just to ensure that things are being done correctly. As they advance in their training, they get better and better at what they do, and our training would allow for them in their 3rd year to be very independent in what they do, so they're ready to go out and practice medicine on their own. This is basic standards of training, this is protect the public, and it's been a great thing at Blue Ridge for us to do. Number one, it has, in my opinion, raised the quality of care that we provide for our community. It has given more opportunities to the residents to practice in community setting, because a lot of the graduates of the medical school choose to go into rural, underserved, or community-based hospital settings to practice, and what better place to train than where you're going to practice when you get out.
Our resident physicians are licensed by the state of North Carolina also. They have resident training licenses for their 1st year, and then many of them are eligible for a full license after their 1st year of training. Some would choose to continue with their resident training license. Some could even be eligible to do some moonlighting after the 1st year of training. So that gives you kind of a reflection of what their level of expertise is. They go through a fairly strict criteria of evaluation before they're accepted in the residency program.
These are fully qualified, well-trained physicians, doctors in training that are in our program. They have moved beyond the medical student status, although we have many medical students around our campus. They are practicing high-quality medicine. They are supervised by us. They are practicing like us, if you will. Our patients don't need to think that they are receiving any lesser care than if they saw us personally. And in fact, we want them to feel like they're getting above and beyond, that they're getting a bonus, they're seeing a 2-for-1.
In the 40s, 50s, 60s, and 70s, most physicians could go into practice after 1 year rotating internship. They had very little training in outpatient medicine. It was almost all inpatient medicine. And they sort of had to learn while they were working. The residency programs that have been established in family medicine and other specialties like internal medicine and OB/GYN and pediatrics all allow for outpatient training as well as inpatient training. So we think it gives them a much more broad spectrum of what they're actually going to be doing when they're practicing medicine and they are board certified in family medicine.
We are considered full-time faculty with the residents. We have devoted a majority of our time now for them and can really give them some one-on-one attention as well as a group in their training. Currently we have 9 resident physicians. Our program is approved for 15 positions, and our goal is to have 15 resident physicians, family medicine resident physicians at all times. We'll have close to, if not over, 6,000 patient encounters a year in our continuity clinic. That doesn't include any of the inpatient or any of the other rotations that the residents will be on. Our residents are also required to do a research project, gather information, collect information, do a study that is publishable. And so something you'll start to see around Blue Ridge is our residents collecting data, doing research to present and or publish in the future, and also to meet their requirements for graduation. So I think our patients will start to see more of an academic feel in this location. However, we want to make sure that we're still making them feel comfortable and that they feel like they're getting the attention and the care that they've always received.
One of the patients of one of the residents has spoken to a friend of theirs to try to get them to come see the resident as their physician too. So I think that speaks to the quality as well as to the completeness of care that our resident physicians are providing.